Global public health authorities and international transport networks are responding to an isolated but highly scrutinized outbreak of the Andes strain of Hantavirus, originating from a cruise ship in the Atlantic. The incident has triggered a wave of localized quarantine protocols, contact tracing efforts, and intense public debate regarding travel safety regulations. The primary source of the current transmission sequence is the cruise vessel MV Hondius, which departed from Ushuaia, Argentina, on April 1. During the voyage, a 70-year-old Dutch passenger developed severe influenza-like symptoms on April 6 and subsequently passed away on April 11. In a highly critical development that brought the pathogen directly into international transit infrastructure, the deceased passenger's wife experienced a rapid worsening of her health while accompanying his body home. She passed away at an airport before receiving emergency medical care. This tragedy prompted health agencies to initiate immediate contact tracing for the approximately 80 individuals who shared her commercial flight. Additional cases emerged as the vessel continued its itinerary, including a British passenger who fell ill in mid-April and was medically evacuated to South Africa, where laboratory analysis confirmed a positive match for hantavirus. Since then, the ship's medical officer became critically ill, and multiple other passengers have tested positive, including a Swiss national who was diagnosed upon admission to a hospital facility in Zurich. 3 deaths have been officially recorded in connection with this specific maritime cluster. For viewers tracking global public health reporting, the situation highlights the complex logistics of modern disease surveillance, the strict enforcement of specialized quarantine jurisdictions, and the sensitive nature of international air travel when a high-consequence pathogen is detected. Historically, hantaviruses are categorized as rodent-borne pathogens maintained in nature by specific wild rodent reservoirs. The virus is shed through the animal's urine, feces, and saliva. Humans typically contract the virus by inhaling microscopic airborne particles of dried rodent excreta, an exposure pathway known as aerosol transmission. This frequently occurs in confined, poorly ventilated spaces where dust or debris has been disturbed without wet mopping or proper respiratory protection. While most hantavirus strains found globally do not spread between humans, the Andes strain involved in this maritime incident is unique because it possesses a documented, though rare, capability for person-to-person transmission. Epidemiological data indicates that this form of interhuman spread requires prolonged, intimate, or close face-to-face contact, typically observed within households or among healthcare providers administering direct patient care without specialized airborne precautions. Virologists emphasize that the baseline transmission dynamics of hantavirus remain fundamentally different from highly contagious respiratory viruses such as influenza or the coronavirus, meaning that it does not move effortlessly through communities via casual outdoor contact. The operational response to the MV Hondius cluster has mobilized multiple national health departments, municipal medical services, and transport unions, revealing distinct strategies and points of institutional friction. In the Netherlands, the National Institute for Public Health and the Environment, known as the RIVM, alongside municipal health services, managed the repatriation of Dutch nationals who disembarked from the cruise ship in Tenerife, Spain. Upon landing at Eindhoven Air Base on May 12 via specialized transport, all repatriated individuals underwent mandatory medical screening, and laboratory samples were collected directly at the airfield. To contain any potential viral leakage, the Dutch government implemented a strict 42-day home quarantine regime, which commenced retroactively from May 6, the date the infected individuals disembarked the vessel. Under these guidelines, quarantined individuals must remain at home, but are permitted short walks outdoors, provided they maintain a minimum physical distance of 1.5 meters from others and wear a medical face mask. For foreign crew members and passengers unable to isolate at a private domestic address, specialized quarantine hotel accommodations were requisitioned. Concurrently, France enacted its own stringent 42-day isolation mandate following the confirmation of a hantavirus infection in a French citizen. The patient, who began exhibiting symptoms during a repatriation flight from Tenerife, was placed under close medical observation in Paris alongside 4 other passengers, while Health Minister Stephanie Rist confirmed that all known contacts would face systematic retesting. On the other side of the world, Australia initiated its containment protocol, returning passengers to the Centre for National Resilience in Perth for the first 3 weeks of their mandatory 42-day quarantine. This facility, originally constructed during the previous pandemic era, is being utilized to observe individuals safely through the virus's exceptionally long incubation period, which can extend up to 6 or 8 weeks. The aviation sector has witnessed a surge in regulatory demands from labor groups. The Association of Flight Attendants, representing airline cabin crews, issued a formal demand calling for commercial carriers to institute mandatory pre-flight screening protocols. The union requested that ticket and gate agents actively question all passengers at check-in regarding any potential contact with rodents or symptomatic individuals within the preceding 45 days. Under the union's proposed framework, any passenger answering in the affirmative would be denied boarding and allowed to rebook without financial penalty. Furthermore, the union advocated for airlines to supply surgical or N95 masks to flight crews and any passenger displaying respiratory symptoms mid-flight. In contrast to these union demands and the strict border quarantines, international health experts are actively working to counter public anxiety and widespread online misinformation regarding a return to sweeping global lockdowns or broad municipal mask mandates. Dr. Gustavo Palacios, a prominent hantavirus expert and professor at the Icahn School of Medicine at Mount Sinai, publicly stated that the public has lost perspective, emphasizing that a severe localized outbreak on a cruise ship does not equate to a worldwide pandemic threat. Medical professionals, including infectious disease experts, have noted that all post-flight contacts who developed symptoms and underwent subsequent testing have so far returned negative results for hantavirus, with their illnesses attributed to conventional seasonal pathogens like the flu. While some independent public health networks have written open letters to the World Health Organization urging a shift toward universal airborne and N95 respirator recommendations due to unresolved questions about toilet plume contamination and aerosol pathways. Official agencies maintain that standard clinical precautions, combined with close contact transmission barriers, are highly effective. Public guidance and long-term surveillance strategies for managing hantavirus risks rely heavily on established environmental hygiene standards and a clear understanding of the limits of current medical science. Because the primary vector for the Andes strain is confined to specific rodent populations indigenous to South America, public health agencies like the RIVM emphasize that the virus cannot establish a permanent natural reservoir through urban pests in European or Australian regions. For the general public, standard prevention involves minimizing contact with wild rodents and their nesting areas. When cleaning spaces that may have been exposed to rodents, such as cabins, sheds, or storage units, health guidelines strictly advise against dry sweeping or vacuuming, which can launch dried viral particles into the air. Instead, the area should be thoroughly soaked with a disinfectant solution or diluted bleach, and waste should be wiped up using gloves and appropriate respiratory protection. Within healthcare environments, standard precautions are mandated for all suspected cases, including rigorous hand hygiene, environmental decontamination, and the safe management of bodily fluids. For any clinical interventions that are classified as aerosol-generating procedures, hospitals are required to deploy full airborne isolation protocols, including negative pressure rooms and specialized respirators, to protect medical staff from inhalation risks. Significant uncertainties remain a core challenge for global epidemiologists tracking this event. The precise threshold for human-to-human transmission outside of close contact environments remains under active study, and the lengthy incubation period of up to 42 days forces health departments to maintain prolonged, resource-intensive observation periods before an individual can be definitively cleared. There is currently no widely available specific antiviral cure or universally approved vaccine for hantavirus infections, meaning clinical management limited to supportive care, fluid regulation, and intensive respiratory therapy for those who develop severe pulmonary symptoms. Despite these challenges, health authorities reassure the public that the threat to the general population remains extremely low, as the current case count is strictly confined to a known cohort of travelers and their immediate contacts under active surveillance. Institutional trust remains a vital component of the ongoing response, as public health departments seek to balance transparent risk communication with targeted, evidence-based interventions to prevent localized outbreaks from causing unnecessary disruptions to global commerce and travel. For ongoing coverage of global public health developments and breaking news reporting, consider subscribing to this channel. The operational response to the MV Hondius cluster has mobilized multiple national health departments, municipal medical services, and transport links, revealing distinct institutional protocols and severe containment friction. In Europe and beyond, governments have moved swiftly to isolate travelers linked to the vessel, which completed its evacuation at the port of Granadilla in Tenerife, Spain, before sailing to Rotterdam for total disinfection. According to statements from the World Health Organization and national health ministries, a total of 11 cases have been recorded, including 8 laboratory-confirmed infections of the high-consequence Andes virus strain, 2 probable cases, and 1 inconclusive case under review in the United States. The outbreak has claimed 3 lives, including 2 confirmed fatalities and 1 probable case. On May 12, World Health Organization Director General Tedros Adhanom Ghebreyesus issued an official statement from Madrid confirming the data, but clarifying that there is currently no evidence indicating the start of a broader, uncontained community outbreak. However, Dr. Tedros explicitly cautioned that the extreme biological traits of the Andes hantavirus require heightened vigilance, noting that because the virus features a remarkably prolonged incubation period stretching anywhere from 1 to 7 weeks, further cases may emerge in the coming weeks. To mitigate this specific window of risk, the World Health Organization has strongly urged national governments to implement a strict 42-day quarantine mandate for all returning passengers and crew members. Though the technical enforcement of these measures rests entirely on individual state authorities, the logistical reality of this mandate has materialized in varying ways across different national borders. In Spain, health officials confirmed that an evacuated Spanish citizen tested positive for the virus upon arrival and was promptly transferred to a military hospital in Madrid for strict isolation alongside 13 other Spanish passengers, all of whom have initially tested negative. In France, where a passenger remains in intensive care in stable condition after developing symptoms mid-repatriation, the government held 2 emergency high-level meetings to coordinate tracing and systemic retesting protocols. In the Netherlands, authorities received 2 evacuation flights at Eindhoven Airport overnight. 1 aircraft carried 19 crew members and 3 medical professionals, which resulted in Dutch citizens being dispatched directly to home isolation, while 17 crew members from the Philippines were escorted to a dedicated government quarantine facility. A second flight chartered by Australian authorities transported 6 passengers, including 4 Australians, a New Zealander, and a British national, to a secure transit zone near the airport for temporary containment before they could proceed with their journey. Clinical and laboratory protocol errors have added layers of internal complexity to the containment timeline. In a notable institutional incident, 12 medical employees at the Radboud University Medical Center in the Netherlands were hit with a mandatory 6-week quarantine order. Hospital administrators revealed that the staff members had inadvertently violated safety rules by incorrectly handling bodily fluids, specifically blood and urine samples, extracted from an admitted hantavirus patient who arrived via the evacuation flights. While the hospital public relations team stressed that the actual transmission risk to the workers remains low, the severe 6-week isolation order was deemed legally necessary because biological materials must be processed under the highest tier of infectious disease controls. Simultaneously, Geopolitical transit hubs are handling the ripple effects of the cruise itinerary. The remote territory of St. Helena, where the MV Hondius docked between April 20 and April 24th, triggered localized contact tracing after it was revealed that two passengers displaying mild symptoms had temporarily disembarked and interacted with island residents. Local public health officials issued an urgent directive ordering anyone who made close contact to enter self-isolation, instructing residents to monitor themselves for sudden fevers exceeding 38 degrees Celsius and to call the hospital for remote triage rather than appearing in person. Meanwhile, as the cruise ship arrived back in Rotterdam on May 18, with 23 international crew members and 2 monitoring Dutch medical officers, the entire cohort entered an immediate lockdown on site for retesting. The strict nature of these government quarantines and targeted containment structures stands in sharp contrast to sensational online claims and media hyperbole regarding sweeping permanent municipal airport lockdowns. While independent labor groups and travel sectors continue to monitor the long incubation period with immense caution, official data shows that outside of the explicit tracked maritime travel cohort and intimate caregivers, 0 cases of casual community transmission have been verified. Keeping the broader public risk baseline low, managing the aftermath of the MV Hondius Hantavirus cluster requires a highly synchronized approach to public health surveillance, precise environmental remediation, and absolute clarity regarding the known limits of clinical medicine. For public health agencies, the immediate priority remains the enforcement of the 42-day monitoring window for all identified contacts, a time frame dictated by the exceptionally long incubation period of the Andes virus strain. Because this pathogen is primarily maintained in nature by specific long-tailed pygmy rice rats native to certain regions of South America, experts emphasize that there is no biological possibility of the virus establishing a permanent environmental foothold or a new wildlife reservoir in urban European, North American, or Australian transport hubs. The practical takeaways for individual protection and public safety remain anchored in rigorous, evidence-based sanitation protocols rather than widespread panic or arbitrary restrictions. Standard international health guidelines dictate that when dealing with potential rodent-infested environments, individuals must completely avoid dry sweeping or vacuuming, as these actions actively loft dried, infectious viral particles into the air, creating the precise aerosol pathways through which hantaviruses typically infect humans. Instead, the universally accepted procedure requires thoroughly saturating the affected surfaces with a liquid disinfectant or a diluted household bleach solution, allowing it to sit to deactivate the virus, and then carefully wiping the area while wearing protective gloves and appropriate respiratory equipment. Within medical facilities, the guidance is even more stringent. Hospitals managing suspected or confirmed cases are required to enforce strict contact barriers alongside specialized airborne isolation protocols, particularly during aerosol-generating medical procedures such as intubation, to guarantee that healthcare workers are insulated from any potential interhuman transmission vectors. From a therapeutic standpoint, global health authorities must navigate significant clinical uncertainties. There is currently no widely available, specific antiviral cure or universally approved vaccine tailored specifically for the Andes strain of hantavirus. Consequently, medical intervention is strictly limited to early supportive care, precise fluid management, and intensive respiratory or circulatory therapy for patients who progress towards severe pulmonary symptoms. This lack of a direct pharmaceutical solution underscores the critical importance of rapid detection, transparent reporting, and immediate isolation at the very first sign of compatible clinical symptoms. Beyond the technical and medical dimensions, the ethical responsibilities of global health reporting and institutional action come into sharp focus. The contrast between necessary targeted quarantines and the sensationalized media narratives regarding global travel shutdowns serves as a reminder that public safety is best served by verified facts, not fear-driven speculation. Public health agencies face the delicate ethical challenge of protecting the broader population through firm, legally mandated isolation measures while simultaneously safeguarding the dignity, privacy, and well-being of the individuals and crew members who find themselves confined to quarantine facilities or their homes. Mitigating a high-consequence pathogen outbreak requires maintaining a careful equilibrium where transparency dispels rumors, targeted science guides logistics, and a calm, methodical response prevents a localized maritime health crisis from transforming into unnecessary economic or social disruption. As international monitoring continues to track the remaining days of the observation period, the global community is reminded that institutional vigilance and structured public awareness remain the most effective tools against emerging infectious threats. For continued, objective coverage of breaking global health news and deep-dive public health reporting, consider subscribing to this channel.